And now, South African nurses and medical workers were on the streets today here in Gauteng. They're demanding better working conditions. DENOSA members marched to the offices of the Provincial Health Department, the Treasury and the Gauteng Premier, David Makura. eNCA's Gauteng Whittles was on the march as well. He joins us in studio. Gauteng, good evening. What are the issues?
Well, there are a number of them. There are 19 demands that were in these memorandums. Chief among them is the treatment of nurses in Gauteng and a call for them to fill the vacant posts. Right now, they say there are only 500 nurses in the training college in Gauteng. It's just not enough to meet the demand. The ratio of patients to nurses in Gauteng is around 1 nurse for every 200 patients. Today, we spoke to the nurses. They're heavily overburdened. Some of them can't keep up anymore, along with dealing with the after effects of COVID-19 on their mental health, on their social well-being as well. They're dealing with clinics without any power or water, forced to read the files with their cell phones. That's just not tenable at this moment. So they're asking the Gauteng government to intervene urgently. They've staged this big march. All right, there was about 100 of them, but their demands certainly are huge. And the fact that they've gone to the Gauteng Premier's office, the Treasury, and the Department of Health signals that they're trying to get maximum impact for these demands. They're demanding the placement of the vacant posts. They're demanding the payment of outstanding salaries. About 20 nurses still owed salaries. Then they're also demanding the correct payment of nurses who've got a higher qualification but aren't being paid for that. So essentially, these are people that have taken themselves to nursing college while being employed at a clinic or at a hospital and then received the qualifications, but their salaries just haven't been raised. And the Department of Health is offering them a 2% increase. They say that's just not enough considering the price of petrol. They were very desperate out there on the streets, and you could tell that from their leadership that they were hoping that this kind of march would yield significant outcomes for them. In the end, they seem just happy with having an official there to receive the memorandum, although they did want the memorandum to be received by the Premier because they consider these issues to be so urgent. But let's take a look at what the Provincial Secretary for DENOSA in Gauteng had to say. He's wrapped up the demands and also painted a picture of the situation these nurses are facing.
As at the last report that we got, we still had about 20 or so healthcare workers who were still not paid. And then there's about 50 or so who have received their salaries, but only for the month of June. For the past the 2 months that they were not paid, they still haven't received their money set. And this march is to highlight some of the challenges that we've got within the Department of Health. Shortage of nurses, the retrenchment of nurses by the Department of Health, and also issues of security, safety and security, because we've had healthcare workers being attacked in the workplace and so forth. So we are taking this opportunity to highlight those issues and also to highlight the budget cuts that have been experienced by the Department of Health. Hence we are marching to the Premier's office as well.
1 nurse for every 200 patients. Listening to their demands, they're not unreasonable. Safe working environment, proper equipment, not to be completely overburdened. You've spoken to some of the nurses as well. What do they say? I
have spoken to some of them. They've described this as one of their last resorts. Before we get into the commentary from the nurses, it's interesting to point out that the chairperson for DENOSA in Gauteng said at the march that this would be the last time that they're bringing a memorandum and having it received by a few officials. Next time, they'll just occupy the Department of Health and they won't leave until their problems are resolved. That's the level that this has gotten to now. And DENOSA is known for bumping heads with the government at a national level. They've done it multiple times. And in Gauteng, they've done it multiple times. But DENOSA has also been on the forefront of trying to expose some of the corruption that they believe is leading to a deterioration of services. So they've described the budget cuts, which they're calling for to be scrapped, for moratorium to be placed in the budget cuts, as the reason why you have people waiting for an entire day at the hospital before they get seen, saying like some of these problems could be solved just with immediate allocation of funds. But then, interestingly enough, they've called for the fast-tracking of the PPE corruption cases by the NPA, saying that holding those people accountable will also deter a lot of other corrupt activities. And just on that, they've said the Department of Health is notorious for not paying suppliers, and say that the Department of Health needs to implement what they call consequence management. It's soft speak for the heads must roll for the fact that there was no bread available at the Chris Hani Baragwanath Hospital. Chairperson of DENOSA in Gauteng pointing out bread is not tax deductible, and yet They couldn't even pay for bread to be delivered to the patients, and they say that is hurting the good work the nurses are doing. Let's take a look at one of the nurses and what she said about the daily occurrence at the clinics where she works.
Today we have come here because of the conditions that we're working under. First of all, if you go to school by yourself, you don't get recognized for specialties, and you still do the job that you're expected to do as a specialist, and the government is not recognizing us, you know, unless you have been sent by them to school, then only then that they will recognize your specialty and pay you. So we're still working with our specialties and not getting paid for it. We need more nurses out there, and in our communities the population has grown a lot, and the ratio between nurses and the communities that we have to take care of is not equal. We have a ratio of 1 to like 200 patients, 1 to 100 patients a day, you know, that you have to look after. And the patients out there and the communities are complaining about us when we don't have enough staff. As I speak right now, there are people who have retired. There are people who have resigned and gone to other places, and those people are not getting replaced.
Let's face it, these issues are well known. They've been ventilated also by top doctors. Has there been any response from the provincial authorities?
To the credit of the HOD, she did get up onto the truck where the march was happening and address the marchers directly, these nurses and healthcare workers. She said that the Department of Health agrees with most of what they've raised in these demands, and they are committing to have a serious discussion about implementing them, but also following up within the given time frame. That's the usual response that they give at these kinds of marches. But what was clear from the head of the department at the Gauteng Department of Health is that she intended to follow up on some of the urgent issues which were raised there, such as the payment of people according to their qualification and not having them do extra work for no money, and then consider some of the placement of nurses at places where they're seriously short-staffed. So it does look like the Department of Health is ready to respond here. Of course, the NOSA has given them the usual 1 week to get back to them on what they'll do with the demands, and after that, if the NOSA is not happy, they'll stage the sit-in, but it does look like the department is ready to respond.
Yeah, let's hope so. They must be seized with the many problems facing the sector here in Gauteng. Thank you so much, Gauteng Whittles. Still to come on